His only thought was trying to overcome COVID-19, hoping to get out of the hospital alive. And now, weeks later, he's healthy, out of the hospital, and staring down medical costs of over $100,000.
And he's just one of many Coloradans carrying the burden of our high cost of care. And tonight, he spoke with Denver 7's Addie Guajardo.
My heart started pounding. I was shaking when I opened up that envelope. We're $52,988, $16,652, $14,137. Patient's responsibility, $139,254 with 16 cents. Tears started coming down my eyes and frustration started coming out. And you start questioning, why, God, why?
Ernesto Castro spent 10 days in the hospital, 6 in a coma on a ventilator, battling COVID-19. He fought for his life and survived. We spoke with him in April.
Not being able to communicate with anybody, being on a ventilator.
After he was reunited with his family.
I started crying, tears of joy, of course.
He thanked God for a second chance at life. But that light grew dark when he finally gathered the courage to open a letter from his health insurance.
Was it worth it? Am I worth more dead than alive?
Thank you for calling Maritime Health.
Searching for answers, he spent 30 minutes on hold, only to get little clarification from his private health insurance.
Just keep in mind that we're still processing it, but there's a lot of question in that bill, and they started questioning me in regards to, what did you go into the hospital for? I said, simple, COVID.
The insurance claims the hospital failed to bill his care as COVID-19 related. The insurance decided to review this bill after his call. Ernesto also reached out to the hospital. They also tell him his case is now under review. Ernesto and his family have called this place home more than a year. Before he got sick, they had dreams of buying a house. But after receiving this explanation of his benefits, where his insurance denied all of his care, he's not sure about the future. This bill is now under review, but Ernesto's world has been shaken.
My life at this point was placed at a tremendous halt.
Ernesto says he just doesn't understand how his medical expenses were overlooked, and only now, after calling, are under review. Now we reached out to the Colorado Division of Insurance. A spokesperson tells me most people should be protected from surprise bills like these related to COVID-19. And that's for 2 reasons. If the insurance plan is regulated by the department and falls under emergency regulation protection, that means they shouldn't get bills like this. And if the hospital received CARES funding, that means that they are not required to send patients any cost of care. As for Ernesto, he tells me he plans to call the department tomorrow morning to help them navigate this cost of care he's received that has, made him extremely nervous. Reporting live, Addie Guajardo, Denver 7.